insights. Now I would like to get on to how many percentage of patients are having disabled life with MS in India, and also why rare disease status should be given to multiple sclerosis. So I would like to go to Dr. Anu Aggarwal, consultant neurology, specialist cognitive and behavioral neurology. Over to you, Dr. Anu.
Thanks, Pratibha. And I would like to thank Sandeep Chitnis and the MSSI for holding this webinar, and Arun Mohan for sharing your story with us. When we come to how common is MS, Dr. Padma has touched on it. Say, in the beginning, in the last 20, 30 years ago, it was believed that the incidence is 0.3%, 0.3 people per 1 lakh population are affected. And MS was at that point considered a disease of the Western world, but that we know is not really true. And at the moment, WHO estimates that there are over 30 per lakh people living with MS in India itself. And probably this itself may be an underestimate of the actual figures. So if we extrapolate it with the Indian population, we have at least 5 lakh people currently living with MS, and the figures again may be higher than this. So which is a big number. And as Dr. Padma pointed out and Arun discussed, we are looking at people who are at a young age in early adulthood, at the peak, at the beginning or peak of their careers, and they're just starting life. So, which is a burden not only to the families but also the social structure of the country. And if we can, and we have at the moment great treatment available for MS. So if we do diagnose the disease early and offer prompt therapy, we can prevent disability in these patients, which does, as we heard, accumulate over time. Now, coming back to the second part of your question, which was, can you just repeat it?
On rare diseases.
Yeah. So WHO defines rare diseases. It's arbitrarily as any disease where the prevalence of the disease is less or less than 60 per lakh population of the region. And by that definition, we are looking at multiple sclerosis. If we look at India, the incidence is estimated to be 30 per lakh. So it does qualify as a rare disease. And now, what is the advantage of, calling a disease a rare disease? So India, as is true of most countries, has an organization which is called as the Organization for Rare Diseases in India, which at the moment has classified a number of diseases as rare diseases, but multiple sclerosis is not a part of it. Now, why MSSI and we doctors are advocating for this to be included as a rare disease is that, unlike, say, diabetes or cancer or stroke, which we all are aware of as doctors, even if though we may not be specialists in that area, we know it. The lay public knows about them. They know if they have particular symptoms, they need to meet a doctor, and they have a rough idea of what the disease is about. So at a patient level, at a family level, and at a medical level, people are aware of it. So diagnosis is usually not that delayed as is the case with rare disease. And we heard Mohan talk about it, how he's educated, working at a highly functioning job with access to the best doctors in the country. His diagnosis was delayed just because it's a rare disease. So diagnosis, the awareness helps in the patient seeking help, and it also helps the medical system providing the correct investigations to diagnose the disease. Then it also helps in providing medications. For instance, we already have a policy in the country which is called as the orphan drug policy, where for rare diseases, the government and the government agencies, with help from NGOs and pharmaceutical companies, provide access to drugs across the country, and at times with subsidized rates, so that patients with these rare diseases are benefited. So if multiple sclerosis is included as a part of the rare disease, luckily most of the drugs which are available for treatment of multiple sclerosis in the Western world are now marketed in India. So we would then have inclusion of these facilities as a orphan drug policy, and that would help the patients immensely, and the outreach of treatment to the patients would vastly increase. And of course, we would then immediately be able to collaborate with other rare disease organization, with like the NORD in US, the Euro diseases in Europe, and others, where we can exchange notes and see how we can help patient with multiple sclerosis, providing them with help in travel across the country or abroad, access to jobs, access to NGOs, patient support groups. So that would, and let me not forget the families. It's not only the patient, the families would also come under the realm of rare diseases. So, and of course, it would promote research. So once you have a rare disease inclusion, it would immediately set in more impetus to research into the diagnosis, treatment, and therapies to alleviate disability for multiple sclerosis. So I support the work with MSSI and other organizations, Dr. Padma's work, Dr. Khurana's work, to see that we are included as a rare disease with the ORD, or the Organization for Rare Diseases in India.
Thanks a lot, Dr. Anu, for your
Thank you,
well-rounded,
doctor.
you
In
know,
fact, I would like to
answer for the
just say a
questions.
word that
Yeah.
Multiple Sclerosis Society, MSSI, is also representing for classifying multiple sclerosis as a rare disease. So, of course, it is work in progress, and with support from all of these people, we will be able to get it shortly. Let us hope so. Thank you.
So as we have got the perspective of doctors here, now I would like to get on to Mr. Sandeep only to the conversation. So I would like to ask about the challenges faced by patients due to the lack of awareness about the condition, which I think was hinted by the doctors here as well, and lack of trained healthcare professionals to diagnose and treat the disease. As you work from the ground, you meet patients, a lot of patients, so you'll have a better understanding of the same. So if you go on with your pointers there. Thank you.
Thank you. See, as far as the lack of awareness is concerned, unfortunately, it is really a serious problem as far as India is concerned, because apart from neurologists, even at GP level, people are not aware about it. So many of the doctors, suppose in the forget about complete Mufussil area, even suburbs of the cities, there also, if many of the GPs and all are not aware about multiple sclerosis, the whatever the symptoms are there, and these symptoms, initial symptoms, are completely ignored, and many times some wrong treatment is given because of some other disease. Again, Arun is again one of the leading examples in that case. So such type of thing can happen, and because of not getting early treatment, unfortunately, people have been suffering for disabilities. Earlier, the treatments were not available. See, 20 years back, DMTs, disease modifying therapies, were not available. Very few were available. But now, fortunately, lot of treatments are available, which can, if it is done at the right time, definitely can stop the disability or growing any further. So that is what is really important. That's all I want. So
Thank you for this pointers, Mr. Sandeep.